Rayus team, thank you so much for joining me today. Thank you obviously for listening on this video about 2 of the screening services that we offer here at Rayus, and thank you for everything you guys do on a daily basis. Today I wanted to talk about the two screenings that we do here in Indiana. I want to give you a little bit of background of why we do them and why it is so important that we be really the leader in Indiana on these services, not just in performing the scans, but also with educating our patients and our providers about these 2 really important screenings that we do here in Indiana. So the 2 that we do right now, the one that we've been doing for quite a bit of time now and that we offer both at Indy Northwest and at Avon, is our mammography screening exams. And then the other screening exam that we do that is a little bit newer, we've been doing it for a few years now in the southern centers, Bloomington and Terre Haute. And for a little bit over a year and a half now, we've been doing them at all of our other centers that have CT. And that is our low dose lung screening exams. Both fantastic, both screens that we do really well. Both of them are incredibly well covered by insurance. In most cases, they're fully covered, or if they're not, they have a very minimal copay that goes along with them. Very safe and very effective screening exams. So the first one I want to talk about is our mammography screening. And I really want to talk about not only a little bit of why we do them, the stats on them, but why we really need to believe it's the right thing to do for the patient, and also believe it's the right thing to do to kind of promote it to our patients that haven't gotten screened or the ones that have come in, to get them on the schedule right away for next year as well. So a little bit about mammography. The main reason why somebody gets a mammo exam is for breast cancer. Breast cancer is the second leading cause of death in the United States and Indiana. And it is the second most frequently diagnosed cancer, right behind skin cancer in women in the United States as well. The lifetime risk of a woman developing breast cancer is 1 in every 8 women at some point in their life will be developed with breast cancer. Okay. What's estimated and these are numbers from 2021, so they might be a little bit higher in 2024, but it was estimated in 2021 that there would be 5,460 new cases of females with breast cancer, and of those, there was 910 deaths that were expected to occur because of that. So we're looking at almost about 17 to 18% death rate in those. Okay. Breast cancer or mammography is obviously it's more popular. It's been around longer, and there's a better compliance rate of that. But even with the high compliance and a lot of the causes and promotion that goes behind them, there's still only about 76% of women from the ages of 50 to 74 that have been screened in the past 2 years for a mammo. And I'll go over the stats here in a little bit, but you'll learn that that's in the last 2 years. In most cases, women are eligible for a mammo screen every year, which is every 366 days. So once that 1 year is passed, the very next day they become eligible, which is true about the lung screenings as well. What's really important is that they say there is a 99% 5-year survival rate if breast cancer is caught in the earliest stages, but only 18% of breast cancer patients are caught in those earliest stages. So early detection is so crucial to the health of the long-term health of these patients here. Okay. So a little bit more about breast cancer. So the guidelines on those right now, and this is current as of making this video. We're in December of 2024. Guidelines are always changing. Breast cancer, a little bit of changes here and there, but you'll see with the lung screening, with that being newer, those change quite frequently. So definitely make sure that you are current on what the current guidelines is. But as of making this video right now, women between the ages of 40 to 44 have the option of getting a mammo screening every year. So once they turn 40 years old, they become eligible to get that screening every year. From 45 to 54, they recommend that they should get that screening every year. So in that 45 to 54 range, they should be getting a mammo screen every 366 days or close within that range. When women get 55 and older, they can switch to every other year if they want, but it is still recommended to go yearly if they would like, and they should continue as long as they are within good health and anticipate living longer than 10 years. So there's not really a set end age for mammo screening. As long as your life expectancy is 10 plus years and are in good health, should continue to get these breast cancer screenings here. The other thing that's really unique about mammograms and mammography is it is the one scan, really in radiology, but that we specifically do here at Rayus that does not require an order. So it's really easy to get these patients right back on when they're leaving out, or even when they're coming into the center that day for their annual mammo. We can get them back on a year in advance. Let's get them on the calendar. Let's get that scheduled for them. And I'll talk to you a little bit later on why that's so important. But they do not need an order from their provider for mammo. When they come in, we'll ask them who their main provider is. And a lot of times it may be their OBGYN or might be their primary care provider. But we'll then link them up with that provider. And that's how they'll be able to get their results sent over for them. Okay. The other screening that we do here as well is the low-dose lung screenings. As I said, we've been doing them quite a while down in Terre Haute and Bloomington, and just in the last few years, starting in 2022, really, we started doing them in all our centers. Actually, that was in mid-2023 when we started doing them in all our centers. So the low-dose lung screens are an exam that we can do in any center that has CT at it right now. So any of our centers that have CT, we can do these at, and it is really a quick, easy. It is booked for 20 minutes. It's a quick exam. The table time is very minimal, low dose, so really a very, very safe screening that is out there. So just a little bit of the information on lung cancer and why it is really so important. Lung cancer is the most common cause of cancer death for both men and women in the United States. And really, that is why they're really you're starting to see a lot bigger push into these screenings, just because the death rates are so high with lung cancer. So in 2021, again, we're going back to these 2021 numbers, 5,960 residents in Indiana are expected to be diagnosed with lung cancer. The even scarier number with that is, of that, 3,520 are expected to die due to lung cancer. So we're looking at almost a 67% death rate for patients that have lung cancer. So that's why it's important to really have these tests to test for them. But you're also going to learn that early detection does help reduce those numbers a little bit. There is a current study out there right now that shows that screening leads to a 20%, early screening leads to a 20% reduction in death from lung cancer. So this 20-minute exam that a patient can have can give a 20% reduction in death from lung cancer. So really important, easy exam. Just really, it's a matter of educating patients, educating providers, and getting them in there. What's really staggering about the lung cancer screenings is currently right now, less than 6% of patients that are eligible for this screen are getting them. So out of every 100 patients that are eligible for a yearly lung cancer screening, only about 6 of those patients are getting that screening. And Indiana is one of the lower compliance states in this. So we really need to be a leader. Rayus needs to be a leader on the forefront in educating patients and providers on getting folks in, and then reminding them that this is a yearly exam. Once you have this, unless you have positive findings, this is something you need to be and can be coming back to year. But Rayus is certainly doing our part in it. I kind of mentioned in 2022, we were just doing it in Bloomington, Terre Haute. We did 347 lung cancer screenings. In 2023, we did 998. And in 2024, we are on pace to do, and I'm filming this in the middle of December, but we're on pace to do 1,200 lung screening exams. So we're really at the forefront in getting these patients in and growing the awareness and really doing our part as far as that goes. For lung screening, again, I say make sure you're always current on what the guidelines are. They've changed quite a bit in the last few years, and I anticipate as more studies come out, as they realize the safety and the effectiveness of this screen, that these guidelines are going to continue to change. But as of right now, it is any patient that has smoked 20 pack years or more, has a history of 20 pack years or more. We'll put these guidelines at each desk, and we'll be happy to talk to anybody about that as well, of how you calculate that. Are a current smoker or have quit smoking within the last 15 years. There is a lot of talk. The ACR is recommending that it does not matter when the patient quit, so we may see that guideline get changed here in the near future, but as of right now, it's for anybody that currently smokes or have quit within the last 15 years, and for patients that are between the ages of 50 to 80. Okay. Unlike the mammos, the lung screens are a little bit different, and that these patients do need an order from their provider, and that is every year. So we can certainly get these patients, and we want to get them rescheduled at the time of their service, but we also want to put the extra caveat in there for them is, hey, we're going to book you out for 366 days or whatever day after 366 is convenient for you, but you will need to get a new order for your provider. So when you go for your next time in for your annual appointment, let your provider know, hey, I got my lung screening last year, I'm booked for next year, can you send my order right now? Or just encourage them to reach out to get that order. If not, that is certainly something that we can do as a team when it gets out there and we confirm the appointment. We can call over the provider, easy to get that lung screening order, or you can have one of your AE team members assist with getting that order as well. So a little bit different there. Hopefully that'll change in the future, but as of right now, we do need an order every year for that lung cancer screening, okay? Why is it so important that we promote this? Well, again, we talked about it, even as long as breast cancer research and events and awareness has been out there, we're still only at 76% compliance. And with the lung cancer, it's just staggering that only 6% of people are taking advantage of this. But it is truly the right thing to do. The studies are out there. It's approved, well approved by insurance. If insurance is approving it, that shows you that they see a lot of value in the long-term health of these patients by getting this done. So we need to be doing it because it's the right thing to do and not just because it's a policy or procedure. Educating these patients that either are in for another scan and are interested in learning more about it, or patients that are currently in and letting them know, hey, you need to get this booked on the schedule for next year. Another reason is, when they go to see their medical provider, it could be any of their providers. There's a lot of things they're covering on that visit, and these two things just may get overlooked. They may not discuss breast cancer or lung cancer. So we give another resource out there. We can be a leader in educating these folks about this, and then if they do meet the criteria and they do have any concerns, they can bring that up to their medical provider on their next visit. It's best for continuity of care. Research shows that if you do reschedule appointment at the time of, you book it a year out in advance, you'll be a lot more compliant, and you're more than likely to come in that following year. Patients that don't schedule, they may continue to put it off. Let's be honest, coming to get a scan at Rayus or any other imaging center is not the most exciting thing in a person's day. So if they are due for that annual and they don't already have something on the books, they may continue to push it out and push it out and push out. We're looking at 1 year, 2 year. If we do have them on the schedule, and even if that specific date does not work for them, when we call them for the reminder, hey, I booked that out, that day doesn't work for me anymore, but here's some dates that do. And it's a lot easier for us to move somebody around that's already scheduled than to try to reach out to them with a reminder letter or a phone call, or just them remembering, hey, that year's up. It really serves as that reminder for them. So really, we do a lot of driving with that, and we can really do our part in getting these patients back in. So I hope this helped provide a little bit of insight into why we do these scans, why getting them in for the yearly appointment is so important, and what we can do as our part in educating folks that might have never received the scan and could be interested in getting one, or why it is so important for us to really get those patients scheduled for the next year, or encourage them to call in and make sure that they get themselves and reminded about that. If you do have any questions about either of these 2 screenings, please reach out to your leader. You can reach out to me, Tim, or any of the other AE teams too could provide some of that information. Happy to provide any education at the center so we can hand out to patients on both the lung cancer screenings and mammographies. And in addition to that too, I'm going to put together a tutorial video that'll be led by our scheduling team just to go step by step how you take a patient that is currently getting their scan and how you get them rescheduled for next year. So I am certainly looking forward. I take a lot of pride in this and am very passionate about this, and really want Rayus to be the leader, specifically with cancer screenings in Indiana. I think we can play a huge role in building a healthier community, providing education and compliance in getting these scans. Thank you so much. Thank you again for everything you do, and have a great rest of your day.